So the fasting state. So you see the reason why you should fast. And imagine you when you are constantly eating rice every day of your life. What will happen? Are you going to be normal? No, you are not going to be more normal. Secondly, you not feel comfortable. You have so many foods, but what you're eating every day, rice, 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 no other food. So that is what the body is also trying to pass through to us. When we keep on eating, and eating without fasting, it will cause some physiological damages. It can lead to what? Obesity. When we keep on eating, and when we are eating, we are not exercising our body, it can lead to what? Obesity. So we have the blood, the glucose level fall, and the glucose level falls only whenever we are fasting, maybe due to economic purpose, due to spiritual purpose, due to prolonged starvation, or you have not eaten for a while. That is when we call it what? A fasting state. And it is by hormonal flip and fear mobilization. And these fasting states will now lead to what we call hypoglycemia. So the fasting state is what we call what? Hypoglycemia. During the process of babies, the blood glucose level is low. So whenever there is high glucose level is in the what? In the feeding state, which enzyme is released? Insulin. And that process is called what? Hyperglycemia, because it's high level. Whenever the blood glucose level is low, we call it what? Hypo, not no more hyper. Hypoglycemia. And which enzyme is released? Glucagon. Glucagon is released. Glucagon will start inhibiting insulin. So glucagon is released. Hyperglycemia, low level glucose. Which state does it occur? In the fasting state. And which enzyme is released? Glucagon. So we have, whenever blood glucose level is low, two things happen. Insulin drops. Insulin is inhibited by what? Glucagon. Pancreatic glucagon rises. So glucagon are released whenever the blood glucose level is low. An enzyme called glucagon is released, which process in the fasting state and hypoglycemia have already occurred. So this glucagon does two works. It activates hepatic glycogen phosphorylase. So we call it hepatic because it is in the liver. We call it glycogen phosphorylase because we are removing the phosphate group from the glycogen in order to convert them to glucose. And where is this thing done? In the what? In the smooth endoplasmic reticulum. So this is the smooth endoplasmic reticulum. So where are we converting? Where are we releasing the phosphate group from glycogen? We call it what? That process is what is doing it? An enzyme called glycogen phosphorylase. And where is this occurring? In the smooth endoplasmic reticulum. So you know that glycogen are formed where glucose are added phosphate, and these phosphates now polymerize by these phosphates are joined together by a bond known as what? Alpha 1,4 glycosidic bond. As it's stretching, then when they start branching, it is now branched or bonded or joined together by alpha 1,6 glycosidic bonds. So an enzyme called glycogen phosphorylase in the endoplasmic reticulum in the smooth endoplasmic reticulum now starts releasing the phosphate group in the what? In the glycogen. So first the glycogen is constantly broken down, and this glycogen is broken down, it is now converted to glucose 1-phosphate. From glucose 1-phosphate to glucose 6-phosphate. Now glucose 6-phosphate, since we are trying to make glucose and we said glucose is bidirectional, what we're going to do is to remove that phosphate. What we have is now what? Glucose. And where is the glucose going to? To the blood. So it also activates hormone synthesis, which is what? Lipase. Hormone synthase what? Lipase. It also activates hormone synthase lipase. So what is happening to the hormone synthase? You remember the word lipase. Lipase are constantly breaking down lipid. So do we have lipid in our body? Yes, we have lipid. Where are they? In the adipose tissue. So which enzyme is responsible for breaking them down? The enzyme responsible for breaking them down are called lipase. Hormone sensitive lipase breaks them down. So while the glycogen phosphorylase release the phosphates from the glucose 6-phosphate in the smooth endoplasmic reticulum of the liver cell. That's why we call it what? Hepatic. So as it releases this glucose is now taken to the blood. So, and when it's taken to the blood, the brain now constantly make use of this energy. So this is the reason why the brain have a source of energy, and 80% of energy supplied by the brain is from where? From glucose, and 20%